medical emergency within our state.
Did you guys hear the question? The bottom line is, what happens if there's a serious outbreak? Okay. Well, I'm the county health officer in Natrona. I have legal right to close the border, quarantine the hospital, regulate what's going on in the emergency room, do those kind of things. Let's say it's bird flu. Now, if I feel like there needs to be mandatory vaccination because of an outbreak that's going to kill half the population, I'm going to do it. If someone refuses that, I quarantine them into their home. And I can legally do that, and they don't have to get the vaccine, but they have to stay at home. But I don't do it without coordinating that with the state health department. I'm very much in tune with the state health department. I've been here a long time. I'm on weekly conference calls with them. So, but yeah, that's what happens. Again, it has to be for the public good. But you say, I will not get this vaccine, there's anthrax in your community and I won't do X, Y, and Z. Then, okay, I'm not gonna hold you down and do it, you're gonna stay at home. And if you leave, you're arrested because you can't leave your home for the good of the public. That's how it goes legally. Am I correct there? Okay.
Sir? Dr. Dowell, I appreciate you coming up for this. Now, I haven't spoken to the pediatricians here, but I kind of get the gist of what the issue is. But can you explain to me better, who is at risk when an unvaccinated child comes into the pediatrician's waiting room or comes in to see them? Who is at risk? It's not the kid that, it's not just the kid that's not vaccinated.
Right. If an unvaccinated child goes into a waiting room, and that waiting room has children or adults that have compromised immune system, whether it's a rheumatoid arthritis, grandma on some of these immune drugs, whether it's one of my AIDS patients, maybe it's somebody that's got leukemia, bone marrow transplant, whatever it is, or other unvaccinated children, newborns. It puts them at risk. Can be communicated. Measles is incredibly contagious, as you saw from the Disneyland outbreak. Puts them at huge risk, and that's another concern of the pediatricians, is protecting the other patients. You can imagine if the child has a communicable disease and goes into a school and 5% of the children are not immunized against measles and introduces measles in there, you got a big problem. And the vaccines are, if not 100%, pretty close. Not all of them. Mumps, for example, is not, as you've seen in the college outbreaks, but that's not a serious disease, let's say measles. So it's not only the protection of the kids as they morally feel is their obligation and what they are trained to do, but it is also their moral obligation to protect those patients, as you said, that are at high risk. If you have someone, let's say, well, let's say a kid was not, now this is not such a serious thing, but chicken pox. It used to be everybody got chicken pox, right? Now we vaccinate our kids for chicken pox. Woman's pregnant in the waiting room, kid comes in, unvaccinated, chicken pox, pregnant woman gets chicken pox. I've seen them die from chicken pox. So the point is, we have an obligation to think of our entire population. Very good question, yes.
Can you also briefly speak to people that talk about the amount of aluminum, mercury, heavy metals in vaccines and or the risk of autism and the science that might be there?
Okay, well, the autism thing is incredibly complicated. There is not a single set of studies that demonstrate vaccine-initiated autism. There's nothing out there. The studies have been looked at and looked at and looked at. The good science isn't there. Autism is horrible for a family that has a child with it. There are a lot of things that probably play into why people develop autism, including genetics. but the Vaccine Association is not there. And that is throughout the medical community. I just don't believe it. It's not there. The studies are lousy. And what was the other question?
Mercury alone.
Oh, the mercury. There is more mercury in a can of tuna fish than there is in the vaccine. So that's just bogus. That stuff is crazy. The heavy metals, no, you get more heavy metal exposure from some of the beef we eat.
Again, it's not an open forum. Oh, you want to repeat?
I was just, I'll come next month if nothing.
Yeah, this was a great discussion. I really appreciate the public comment. I really appreciate your expert opinion on this. I just want to rehash that again, CCH and CCMG do not have a formal policy stating that we are not seeing unvaccinated children. Basically, we respect patient rights. We also respect physician rights. They are provider rights, I should say. They are well-trained individuals that have spent a lot of time educating themselves and continuing to educate themselves. As a board, I want to make sure that we have choices for the residents of Campbell County so that all people can be seen. I want to make sure that we have options, and I assure you that we will continue to have options. I'm sure this dialogue and this discussion will continue, and CCH administration will certainly respond to all the points that were brought out this evening. So I want to thank all of those involved, but that's all the time we have for this issue. Thank you very much.
Thank you for